All right. Um, in this particular video, I want to give a kind of a brief overview of the gross anatomy of the heart, external and internal anatomy. Something to keep in mind is that some of you may be watching this and you may think that this isn't in a level of detail or depth that you may like. This video is more for people who are kind of starting the undergraduate level. But I would hope that if you're in the graduate school or medical school, that this would be a good refresher review for you. But just keep in mind that this is the audience, that's the audience who I'm making this video for. So if anyone has any complaints or any comments about a very specific structure that I missed, like I said, I'm not going to go into extreme detail. Like I said, I just want to talk about the gross anatomy of the heart for people who are, in first or second year anatomy and physiology in college, and how, the basic anatomy of the heart essentially relates to the cardiac cycle and the overall functionality of the heart. So hopefully, for you upper level students, that this is in the, that you find this video useful, but bear in mind that I just want to get that out there, that that is the audience who I'm making this video for. So, so on that note, the gross anatomy of the heart. So I want to talk about the anatomy of the human heart. Again, internal and external anatomy, starting with just the locations of the heart in the chest, and then go over some very some basic but important anatomic terms, because it's important. It's very important to start here, because next I want to talk about the cardiac syncytium, and which is basically how cardiac muscle tissue is organized in the heart, and then relate that to the EKG, and then then talk about blood flow through the heart, and then you put that all together, and then have a discussion about the cardiac cycle, which what the cardiac cycle is, it's all of the events that occur in one heartbeat. One beat, in less than a second, all the major events that occur, and it's quite fascinating how much this kind of small organ does in just even a second, worth a second's worth of time. But for the more advanced knowledge, you're not going to get anywhere without having a good basic working knowledge of the structure of the heart. So, so it's very important that you start here, and that you really don't move on until you really just know your heart anatomy. So, all right. So on that note, so the heart. The heart is located in an area called the mediastinum. Probably should have written that on here, but mediastinum. Okay. The mediastinum is basically, I like to think of it as a cavity within a cavity. Basically, the mediastinum is the space between the medial sides of the lungs, because you know that your lungs are going to be, on the lateral aspects of the lungs are going to be in almost direct contact with the lateral borders of the thoracic cage, but on the medial aspect of the lungs, they're not actually touching each other. And that space in between where the lungs are located, that is the mediastinum. All right. And then that's an important anatomic term to remember, because the heart isn't the only important structure that's located in here. The esophagus descends down through here. The trachea, which is about a 5-inch tube for, which basically an airway, descends down to the mediastinum and then bifurcates to form the main stem bronchi, which are basically airways, individual airways into each lung, where they then branch and form smaller airways into the lungs. The thoracic duct of the lymphatic system and flow of lymph is located in here. The aorta, the vena cava, the thymus gland. All right, all structures are located within this space in between the lungs. So keep that in mind. This word here, mediastinum, recite this in your sleep. Say it in the mirror. Hopefully you're not getting that obsessive, but you get the picture. It's a very important term to remember, because it is a term that you're just going to be hearing a lot when you're going over thoracic anatomy. All right. Now, let's get some of this out of the way. Now, let's talk about the heart in terms of its location in the chest, or in the mediastinum. So again, the mediastinum, this picture here is okay. It does, for starters, the heart's probably drawn a little bigger than it should be, but, and then the pulmonary trunk should be, and the aorta should be flipped around here, but that's what you get for relying on Wikipedia for pictures. And another thing about this as well, a couple external features of the heart. This area of the heart rate here, and my pen's already going nuts on me. This area of the heart rate here, this kind of almost pointed off area slightly to the left, is called the apex of the heart. And anatomically that's important to know because one, the apex typically tilts slightly to the left, and just kind of a little bit of inaccuracy with this picture. The apex typically, on average, and again, this isn't going to be for every single human being on Earth, but with the average person, the apex is going to be more. 2, 3, 4, 5. It's usually going to be about in this fifth or sometimes the sixth intercostal spaces. This is almost all the way down in the seventh or eighth intercostal space. So that's just dipping down a little too low there. But just keep that in mind. Why is that important to understand? Well, when you're going to learn how to, put leads on an EKG, you're going to go down on the average person down to the fifth intercostal space and place leads all the way down, all the way around to the midclavicular line and so on. So when you're measuring the electrical activity of the heart. All right, and then the base of the heart, basically, where the atria and some of the great vessels are located of the heart, are going to be up around the second or third intercostal space. So this should be actually tilted upwards a little bit more because the average heart is actually slightly a little higher than this, and usually tilted one direction or the other. Hearts don't just normally sit at kind of a 0-degree angle, flat there. So that's something to keep in mind. All right, so that's kind of the anatomic location of the heart. Now, this is just a list of terms that I'm going to go over that you as students need to be proficient in while you're moving through your cardiac anatomy, like I said, especially at the undergraduate level. And especially when it comes down to understanding the cardiac cycle, as I mentioned before, because a lot of these terms are just going to come back to you, come back to you, come back to you. So make sure you understand these terms. So we'll go over some external anatomy and then internal anatomy, and then take a look at the chambers, somewhat separately. And then I want to talk about the valves of the heart. All right, those are important to understand as well. But first, what I want to talk just briefly about, so again, you've got this list of terms here. What I would recommend doing, while you're watching this video, pause this for a second, write these down, just so you can have them in front of you on paper, because obviously I'm not going to come back to this slide. So I would recommend doing that right now before moving on. Or if you have a book or your professor, teacher, instructor, whatever gave you a list of these terms, that'd be have them handy while watching this. But first, what I want to talk about just briefly is the pericardium. All right. Now, when you're looking at a heart, kind of in vivo inside of somebody, whether you are, going into surgery, you're dissecting a cadaver, whatnot, or whether it's human or any, or a cat or a pig or whatever, the heart isn't. You're not just going to see a fully exposed heart sitting in the chest. The heart, like most organs of the body, or pretty much all organs of the human body, have some kind of connective tissue capsule, surrounding them. The heart does as well. And the connective tissue capsule surrounding the heart is called the pericardium. Just dense irregular connective tissue surrounding the heart. And then you can see this kind of flat lower surface of the heart, the diaphragmic surface. They notice how the heart the lower aspect of the heart almost slightly conforms to the shape of the diaphragm down there. Now the pericardium, all right, again, it's when you actually see it, it's going to be it's almost transparent, but you can see a little bit through it. It's going to be a very white and kind of whitish in color, and it's fairly tough. And bear in mind that the heart itself does not come in direct contact with the pericardium. There's going to be just a small amount of space in between the heart and the pericardium, called the pericardial cavity, or some people call it pericardial space. But just understand that space, that there is going to be a small space, and that space is occupied with the serous fluid. Okay, serous fluid. Remember, when you hear the word serous, you should automatically think watery. This is a watery fluid of some sort. All right, watery, watery, watery. Serous equals watery. Why do we want that there? Because you have to remember the heart, from day one to day expiration, The heart doesn't stop. It continuously works. And remember, the heart is constantly contracting and shrinking in size and then re-expanding in size. And then, based on, and if we physically push and increase the demands of the heart's going to be, pumping even harder and enlarging and shrinking even more. And, while it's contracting. And if that so you probably get in the picture here that fluid in between the heart and the pericardium is there to reduce friction, because remember, where there's friction there is wear and tear, and where there's wear and tear there is damage to tissues. So it's important that that fluid is always there, and I'll talk about where that comes from in a second. And clinically, that's also important to understand that there's this little bit of fluid filled space in between the heart and the pericardium, because sometimes people bleed into this pericardial cavity. And what do you just think about this for a second? What would happen if someone was bleeding into this pericardial cavity? What would happen if blood started to occupy the space around the heart in between the heart and pericardium? Think about it for a second. Okay. So if you said that or if you thought that the heart won't be able to fully re-expand or fully act as a pump, you are correct. Because if we have a bunch of blood filling up around the heart, it's going to be harder for it to expand and fill with blood, and the heart is just going to just act as an inadequate pump. So when people do bleed around this space, then you have to insert a needle, and then you have to drain the blood out of there, and usually it's fairly quickly corrected. I mean, well, once you get the blood out of there, we have to figure out what's causing the bleeding, obviously, but that's typically what'll happen. And what you'll see is you'll see some major cardiac, arrhythmias take place, because remember, the heart itself is an organ. The heart needs blood, and if the heart is being deprived of blood, then it's not going to function properly either. So that's what you're going to see when people bleed around, in that into that pericardial space there. All right, and then you can also see here that these are pulmonary veins. That this is the inferior vena cava, superior vena cava, aorta, pulmonary trunk. So you can see that there's a lot of these great vessels that are kind of normally enclosed. The ends or beginnings of them are enclosed within the pericardial, or the pericardium as well. All right, so let's what I want to talk about next is the heart tissue, or the three tissue layers of the heart. And just a little bit of terminology review here. Just like with the pericardium, remember, peri means what? Surrounding. So whenever you see the word peri, I mean, just think surrounding. Everybody knows what cardio means. Cardio means heart. All right. But then a little review here: epi, endo, myo. All right, when you see epi, you should think above or outside of, on top of something. When you see endo, you should think within. And you know what the word root myo means. This is actually a word root, not a prefix like epi or endo. This myo means muscle. All right, muscle. So keep that in mind. And I encourage you as a student to just focus on the terminology really hard, because I think even a mediocre teacher can really get the concepts across to people. But from my experience, I always notice it's just this new language of medicine that really screws people up. And I'll tell you what, if you make yourselves proficient in the language of medicine, the concepts are going to be so much easier. So keep that in mind. All right, so the epicardium is the most superficial tissue layer of the heart, and this is what generates this serous fluid, that watery fluid in between the heart and the pericardium, and we could call it the serosa. Okay, serosa, the serosa. All right. And keep this word in the back of your mind, because when we get to the digestive system, that's a word you're going to see again, because the outer layer of the organs of the alimentary canal, or the primary organs of the digestive system, also have a serosa, a watery outer layer, which is basically simple squamous epithelial tissue. All right, so that's basically the epicardium. The myocardium, this is the actual working tissue of the heart. Back in histology, long time ago, we talked about the differences between the three types of muscle tissue, and we talked about cardiac muscle. All right, this is cardiac muscle tissue right here, and this is the only area, remember, where you find cardiac muscle tissue is within the myocardium of the heart. And this is a very, very thick muscular layer, and its thickness varies depending on which side of the heart it is we're talking about, and I'll show you examples of that later. All right. And then the endocardium basically is just an inner lining, just a very, very thin inner lining of the four chambers of the heart, the atria and the ventricles. All right. So let's take a look at these layers here. Now, again, you can't really see the endocardium very well on this picture here, but um, just think that on the very, very outer aspects of the heart, there's a very thin layer around the heart that is forming that serous fluid, this watery fluid that's normally occupying the pericardial space, all right, or the pericardial cavity. This very bulky, thick red tissue that you see here, this is the myocardium. All right, myocardium, remember myo meaning muscle, all right, and then cardium, heart. All right, so this is the actual pumping, working tissue of the heart. And when people have heart attacks, this is the tissue that actually dies. All right, this is the tissue that becomes ischemic, from a blocked coronary artery. And then when this tissue doesn't get oxygen, it doesn't take long for damage to set in. And if the damage is too extensive, remember the myocardium is like, other forms of muscle. Remember we said it's very similar to skeletal muscle. This is tissue that does not regenerate. So when people have bad, massive heart attacks, their hearts are going to become just less efficient pumps. And in the long run, that's probably going to lead to congestive heart failure, where, the use of medications are going to have to be, implemented in these folks' daily lives to try to control the imbalances in water they're going to have. All right, and then you can see this kind of whitish, this shiny looking tissue in here. This would be the endocardium. Again, it's just a shiny, smooth layer of tissue that lines the inside, the inner chambers of the heart. Makes it easier for blood to just kind of move along, to flow more easily through the chambers. Remember, blood is a really sticky, thick, kind of sludgy fluid. Remember, it's not quite a liquid. It's not quite a solid. It's technically a gel. It's a connective tissue. So it's important that we have this kind of slick surface in the inner chambers of the heart to make that thick, sticky gel move around a lot more easily within the chambers of the heart. All right, and this, by the way, is a sheep heart that my students were working on dissecting. All right, so on that note, so we've got the tissue layers out of the way. Let's talk about the chambers of the heart. So basically, there are four chambers in the heart, and two of them, two chambers, there are two of each, I should say. So there are atria and there are ventricles. All right. The atria are going to be the upper chambers of the heart. The ventricles are going to be the lower chambers of the heart. All right. And these first two bullet points, kind of under each of these, is very critical for you to understand when it comes to the functionality of the heart. Anatomically, they're easy to identify, but really when it comes to the functionality of the heart, this is where this anatomy comes in. The atria, for starters, as I just mentioned, are the upper or the top chambers of the heart, and the ventricles are the lower chambers of the heart. Okay? Now, the atria are what I like to call the receiving chambers of the heart. So the atria, these are the chambers where blood enters the heart. All right. This is how blood enters the heart. And bear in mind that there's a right and a left side of the heart. There's a right and a left atrium. Blood is entering these chambers simultaneously while the ventricles are relaxing. All right. And then and you'll see in a second, there are going to be these kind of extensions of these atria called auricles that they're like these little, they're basically, a lot of times people describe them as looking like dog ears or the flail because they're kind of flappy. Basically what these are, this just adds extra muscle and gives the atria just a little more pumping power. All right. And then there's this kind of tough inner lining, not tough, but it's a very web-like muscle tissue called the musculi pectinae, lining the inside of the atria there, which is kind of analogous to these trabeculae carnae. Again, this mesh-like network of muscles, located within the chambers themselves. All right, so the atria are the upper chambers of the heart. Blood enters the heart via the atria. And then the ventricles are the bigger lower chambers of the heart, and these are the pumping out chambers of the heart. Okay, remember the ventricles pump blood out. All right, the ventricles pump blood out of the heart. And bear in mind that they're pumping blood into two different circuits or directions, which I'll talk about more in depth in another video. The right side of the heart is pumping blood to the lungs. The left side of the heart is pumping blood to to basically the rest of the body. All right. So the four chambers of the heart, and let's just kind of take a look at this. And I apologize if these pictures are a little cheesy, but this is the best I can come up with. These are some models that we use. And may this one rest in peace because I lent it to a colleague of mine a few months ago, and uh, came back to me not in good shape. And then one of my students dropped it the other day, and like I said, now may it rest in peace. Um, so what we have here, so first what we'll do is we'll focus on the external anatomy of the heart, and then we'll dig into the inside of the heart. So basically what we have here is this would be the right side of the heart, this would be the left side of the heart. All right. Now I can't stress this enough. When you're looking at the anatomy of the heart, this is really the first thing you have to do. If you don't get your left from right situated, you're screwed. All right, because I mean it's easy to identify ventricles, it's easy to identify atria, but if you're so you won't hurt yourself too bad anatomically, but functionally you're going to be in deep trouble if you don't if you can't look at a heart and differentiate right from left. All right, and with the external heart, it's it's probably a little bit more tough when you're looking at an external view of the heart, but internally I'll give you some tips that makes it very, very, very easy. All right, so if we take a look at just kind of an anterior view of the heart, remember this little dip down here, this point, this would be the apex of the heart. Think about this. I mean, from geometric terms, why do we call this an apex? Well, what shape does this almost look like? Well, a shape that has an apex and also a flattened base. All right. So if you just flip this upside down, then you have a very similar shape here. All right. So this would be the apex of the heart. And then on the posterior side, you can't see it from the front, the anterior side, there will be a base. All right, which is formed by, again, the upper chambers, the atria. Okay, so now, one thing to keep in mind when you're looking at the outside of the heart, remember that pen back here. Remember that the apex usually tilts slightly to the left. Okay, tilts slightly to the left. All right. Now, another thing you can focus on when looking at a heart, when you're looking at it from the front, you're going to see a lot more of the right atrium than you are the left atrium. It's just because most of the left atrium is on the posterior side of the heart because that's where the pulmonary veins kind of meet up and form the bulk of that chamber. And then the left atrium also forms the bulk of the base of the heart. All right, so you'll get more of a view of the right atrium from the front than you will of the left. All right, so keep that in mind. So this and this, upper chambers of the heart, right and left atria. And down here, obviously you can't see inside of any of these chambers, but this would be your right ventricle, and then this would be your left ventricle. All right. Now, from the front, you can see now the right ventricle is a lot more anteriorly positioned than the left. The left ventricle, kind of the inner hollow aspect of the chamber, tends to kind of wrap around to the posterior side of the heart. So the right ventricle is going to be a lot more anterior, and then if you kind of put an imaginary line down here, there's a septum that separates these two chambers as well. All right. And then something else I want to talk about real quick, the auricles of the heart. So remember I mentioned before that the auricles just give the heart a little more pumping power. So this here, this kind of flappy-like extension you see of the atrium, that is the auricle of the right atrium, and then this would be the auricle of the left atrium. Like I said, basically there's just pouches of muscle tissue that allow the atria to pump with more force. And when we're in a situation such as exercise and we're, circulating a lot more blood throughout our body and our heart, that's going to come in quite handy. All right. And then also from the anterior perspective, you can see the, so this right here, this right here would be the superior vena cava, and you can't see it just by the way this model is positioned, but the inferior vena cava would be on the underside or the inferior aspect of the heart, working its way up to the right atrium. So remember that basically blood that is circulating back to the heart from, below the heart is going to be getting back via the inferior vena cava, and then blood coming back to the heart from basically the head, neck, and upper limbs will be circulating back through the superior vena cava. All right. So these two great vessels, or I should say great veins. I mean, vessels or veins, are on their way to the right atrium. All right, now let's take a look at these two here for a second, the pulmonary trunk and the aorta. All right, the pulmonary trunk and the aorta. So you'll notice, so the pulmonary trunk is basically, both of these arteries are what I like to call great arteries because they're, big arteries. Both of these arteries ascend, okay, up and away from the heart, except the directions that blood is going to be a little different. And which kind of makes me want to, think about this for a second. Always keep this in the back of your mind. All right. Arteries carry blood away from the heart. All arteries carry blood away from the heart. Veins carry blood back towards the heart. All right, keep that in mind. I'm going to say this again. Arteries carry blood away from the heart. Veins carry or circulate blood, if you want to be specific, back to the heart. All right. Now the pulmonary trunk is, basically its ascendancy here is going to be slightly anterior to that of the aorta, and then also the right atrium will just tend to kind of cover a little bit of the aorta as well while it's working its way up. Now the pulmonary, this part right here is the pulmonary trunk, all right, which again is ascending from the right ventricle, all right, and not to be mistaken with the pulmonary artery. So the pulmonary trunk is going to go up, is going to ascend a few centimeters, and then it is going to bifurcate and form the right and left pulmonary arteries, okay? And these arteries are carrying deoxygenated blood away from the right ventricle of the heart to the lungs for the gas exchange process. All right, now you're probably looking at this sitting here thinking, well, aren't arteries red and veins blue? Now you have to keep this in mind. Blood that comes into the right side of the heart is deoxygenated. Blood that's leaving the left side of the heart is well oxygenated. So blood that is circulating out of the right ventricle is going to the lungs so we can get rid of CO2 and grab some more oxygen. All right. So even though this is oppositely colored from what you're thinking about, it's still doing what an artery does. It's carrying blood away from the heart. All right. So keep that in mind. And then the aorta, remember I said that the left ventricle, kind of wraps around posteriorly, and then the opening, the beginning of the aorta is almost kind of on the posterior side of the chamber, and so again, it's going to be slightly behind the pulmonary trunk here. And the aorta, essentially, what it does is that there's a couple of parts to it. There's an ascending aorta. And then we've got our aortic arch, or the arch of the aorta. Honestly, I'm not one of those teachers that really cares which of the terms you use. I just want to see you use them correctly, because as you know, many structures are going to have very similar names, and I think it's just ridiculous that there are some educators out there that are anal retentive about which specific out of the multiple names you use. Granted, some are more proper than others, but realistically, I could care less if you say aortic arch or arch of the aorta. It's just easier to say aortic arch. All right, and then the aorta descends down through the thorax and then into the abdomen, and it's going to descend on the back side or the posterior side of the heart. Okay, so here's some of the anterior structures. So let's kind of get a posterior view of the heart. And again, I apologize for the gaping chunk missing out of here. And again, this is what I get for borrowing my stuff out to people. So what we have here, so this right here, so this is just a little bit of the right atrium. Notice how the right atrium is quite long, but it's not really that big, bulky or thick. This right here is basically all left atrium right here. Okay, so remember, we flip the heart around, so now we're looking, the left side is over here and the right side is over here. All right. So this is left atrium, and then this is where the inferior vena cava is going to be meeting up with the underside of the right atrium. So so blood will enter here. And then this structure right here, I talked about in another video, the coronary vessels, called the coronary sinus. This is basically where all the major veins of the heart all kind of join together and form a big bulky, vein. And then this vein also empties into the right atrium. So basically we've got all of our venous return covered from all areas of the body. Superior vena cava, inferior vena cava, and the coronary sinus are all draining into the right atrium. And now you take a look at these red vessels here. Take a look at these. All right, so these are the, and then you see two of them right here. These are the pulmonary veins, all right? The pulmonary veins, um, now again, you see these as red colored. Now again, this goes back to what I was saying before. This is pretty much the only instance of the human body where you're going to see this flipped around, where you're going to see an artery colored blue, you know, in a textbook essentially, and veins colored brightly red, all right? But the functionality is still the same. The pulmonary trunk and pulmonary arteries are carrying blood away from the heart, doing what an artery does, and the pulmonary veins are circulating blood that has undergone gas exchange in the lungs back to the left atrium. So these are veins carrying blood back towards the heart. Okay, don't get confused by the coloration here. These are still veins, and the pulmonary trunk and pulmonary arteries are still arteries. Okay, it's just that the oxygenation levels of the blood are just slightly different between these two. Everything else is true. All right, and then here we can see the base of the heart. So the base of the heart, and if we kind of go down here, so remember this is still the left side, this is still the right side of the heart, and just to get a better look at, you know, without those chambers in the way. So again, here would be the, more of the left ventricle, then this would be, the right ventricle over here. Remember the left atrium, right atrium. All right. Um, yeah, so and then here's our apex, which you can kind of see a little bit. And then remember the underside of the heart is going to be kind of more flattened out because of just how it sits on the diaphragm there. So, yeah, so I think that's I don't know, I think it's a decent enough review of the external anatomy of the heart. Now let's kind of take a look at some of the internal anatomy of the heart and take a look at these chambers a little more in depth. So this would be, again, this is a sheep heart dissection, and this is essentially what an atrium would look like. And I apologize for the poor pictures. When I got these hearts from the company, I tell you what, people, if there's any teachers watching this or even students watching this, tell your teachers to get fresh hearts if they can. I mean, if there's a local butcher shop or something like that, like a pig butcher shop is a really good place to get them. I used to do this because I wasn't my school wouldn't budget me for the parts, so I would drive to a butcher shop and buy them myself. Then they would reimburse me for that, which is weird. But anyway, I'll tell you what, you're gonna just get a better appreciation of a heart if you dissect a fresh one versus one that's been processed and removed and preserved and all that. And because especially with how they ship the hearts, they get really stiffened with all the the phenol and preservatives in there, and then they stuff them all together really tight in a bag, and then the chambers come. These things look like a train wreck half the time when you order them in bulk. From a company. Nothing against these biologic companies. They do great work. I mean, it's great that they're providing these parts for educational purposes. It's just that it's just what you're going to get when you order things in bulk. So what I would recommend is, like I said, if you can get your hands on anything fresh, I mean, use it. I would honestly, I think a pig heart would do really well if you can, if you can find a shop that's kind of slaughtering pigs at around 200 pounds, you can get really good quality hearts to take a look at. So, but again, here you can see these pectinate muscles, these kind of rough looking muscles in here. Then you can see how it looks very shiny on the inside of the atrium, and then this right here is the orifice between the atria and the ventricles, which is normally occupied by these leaflets of these valves called AV valves. All right, so let's take a look at the right inside, or the internal aspect of the heart. So basically, what we have here is we've got the right atrium and the left atrium. So here again would be the right auricle. I mean, you can see the labels on here. So, so the right atrium, excuse me. So basically, what we're going to see here first, the sinus venerum are going to be, you can see these openings right here of the vena cava, the superior and inferior vena cava. That's what the sinus venerum are, V-E-N-A-R-U-M, in case you're wondering how to spell that word. Hopefully you know how to spell sinus. But those are the openings essentially to from these vena cava as blood is kind of entering into the right atrium there. Bear in mind that overall the right atrium is, it tends to be a little longer
A little longer and larger in size than the left atrium, but it's not as thick and strong as the left atrium. And what else do I want to say about this? So what else could we say here? So, then here, this would be the opening of the coronary sinus. So these would be all the areas where blood is draining into the atrium there. Let's see. And then these pectinate muscles, I already mentioned those. What else did I want to say? Now, this structure right here, the fossa ovalis, that is actually a remnants of embryonic development because, for a while, and I can't remember off the top of my head, as one thing I'm not good at is embryology. But for a while during embryonic development, this was a shunt for blood to circulate from atrium to atrium. So normally blood goes, in the atrium down to the ventricles and then out. Well, for a long time during embryonic development, fetal circulation basically went, into the right atrium, right into the left atrium and out, while you're relying on a lot of blood and circulation from the mother. So while the lungs were developing, we don't really use them for gas exchange. So this is again just a remnants of embryonic development there. So yeah, so that's kind of the right atrium that I want to say about that. And then I'm gonna jump down a second here to the left. I can't even really see it that well. The left atrium. Okay, never mind then. So the right ventricle then, I'm sorry for being jumping around there. So then the right ventricle would be, again, the big, lower chamber of the heart. That is the pumping out chamber of the heart. And, again, typically the right ventricle overall, I guess in overall terms of size, is a little bigger. And again, forms the bulk of the lower anterior surface of the heart. But its walls are a lot more thin. All right, the walls are a lot more thin here. So that's something I want to say about that. And then you can see here that this is a valve in between the right ventricle and the pulmonary trunk. And then you're going to see these structures located inside of the both ventricles called chordae tendineae, which stands for tendinous cords. Excuse me. And there you're going to find these little nipple-like muscles called papillary muscles that are located in the chambers. I'm going to talk about those later on. And then there are also going to be, again, these valves, which are basically these very thin leaflets that consist of, these cuffs, as you want to call them, that are connected to the papillary muscles via the chordae tendineae or tendinous cords. All right. And one thing I wanted to show you about the right ventricle as well. Students, sometimes, you're going to be dissecting these hearts. You're going to wonder, what in the heck is this little band running from the septum between the ventricles to the outer wall of the right ventricle? That's called the moderator band, or the septomarginal trabecula. What that basically is kind of an electrical bypass for the cardiac conduction system. I know I haven't gone over that right now, but if you're a student who's already done this and this is a review, so basically what this band does, so the right bundle, there's a section of the right bundle branch that passes through here, and basically that just allows for more rapid conduction to the lateral walls of the right ventricle. So basically it means that what I'm saying here is that this band makes it a little more quick for that action potential, that impulse that's running through the conduction system to get around the walls of the right ventricle. So that's what the moderator band is. So keep that in mind. If you see that goofy little band inside the right ventricle, that's what it is. All right. And then the left side of the heart, if we kind of look at the left lower side of the heart here, we can see the left ventricle. Okay. And then it has a valve as well called the bicuspid or mitral valve. And then there's, just like you saw the pulmonary valve a little while ago, there's going to be an aortic valve. So as you notice, there are valves in between the upper and lower chambers of the heart, and there are valves between the ventricles and the great arteries of the heart. Okay. And I'm going to talk about those later on, but I just want to mention that for now. Okay. What else do I want to say here? And again, remember the left ventricle kind of, again, wraps around more to the posterior side of the heart. And I don't like how this picture was drawn just because, I want to jump back up here for a second. Let's take a look at this image. So let's say you're taking a lab practical and you're looking at this heart. You've been studying your keister off, trying to study, just to identify all these parts, and your wonderful professor or teacher has pins with random numbers on, and you have to identify it. As I mentioned before, it's very important that you just get right from left sorted out. Okay, so here, this would be left, this would be right. Okay, so you're looking at this thinking, well, how in the world did I determine that? Okay, internally, remember your three tissue layers of the heart: epicardium, myocardium, endocardium. Focus on the myocardium here, this middle layer. Okay, so these would be the ventricles. All right, so this is more of a kind of a posterior view of the heart here. So this would be the left ventricle, this would be the right ventricle. Okay. The myocardium of the left ventricle is on average going to be about 3 times more thick than that of the right. All right, and here's why. Because the left ventricle, remember I said the ventricles are chambers that are pumping blood out of the heart. All right, and they're pumping blood out of the heart into 2 separate circuits. The right side of the heart is the right ventricle is pumping blood into the pulmonary circuit for gas exchange. The left side of the heart, or the left ventricle of the heart, is pumping blood into what's called the systemic circuit, basically all of our bodily tissues outside of the lungs, for gas exchange, except just the opposite of what you would think about in the lungs. We're getting rid of oxygen and grabbing CO2 in the tissues. All right. Now, so think about this. The left ventricle has to circulate blood over a greater area than that of the right ventricle, and also through lots of very, very small microscopic vessels. The right ventricle is pumping blood up into the pulmonary circuit, one, not very far from the heart, and two, the resistance to blood flow in the lungs is not that great. Okay, the resistance is very low. Whereas when you're thinking about the billions of capillaries that the left ventricle has to circulate blood through, these microscopic vessels, this chamber, this side of the heart has to work really hard to get that blood not only out to the most peripheral areas of the body, but also back to itself so we can, get oxygen and get rid of CO2. So that's why the myocardium of the left side of the heart has to be so much more thick. All right. So just keep that in mind when you're looking at this. When you're looking at a heart, the myocardium of the left ventricle is going to be 3 times more thick than that of the right ventricle. Okay, so keep that in mind. Now, another thing I wanted to talk briefly about is the interventricular septum. There's a septum between the atria and the ventricles. All right, there's a septum between the atria and the ventricles. So there is going to be, so this right here would be, we can call the interatrial septum, and this would be, as you can see right here, the interventricular. It should say interventricular, not just ventricular septum. Remember, inter means in between, I-N-T-E-R. The prefix inter means in between. Okay. Why do we want these here? Okay, I've already been talking a little bit about blood flow through the heart. That the right side of the heart is, that venous blood is coming. You know what? Let's make this accurate. Deoxygenated blood is, I say let's make this accurate as I draw all the way around here when I should have done it like this into the superior vena cava. But anyway, so deoxygenated blood is entering the right side of the heart. Okay, so this is basically blood that's coming in from the systemic circuit of the body, or basically all of our body tissues, whether it's from the underside of the heart or from above the heart. And this is blood that's going to enter the right atrium, the right ventricle, and get pumped up into the lungs. All right, and you know why we're doing that. We want that blood to undergo gas exchange. Because remember, I want students to get out of the habit of just saying, well, collecting oxygen. Collecting oxygen is important, but simultaneously, it's just as important to get rid of carbon dioxide. All right, so that's why I encourage you guys to say, or gals, to say gas exchange, gas exchange. All right, because simultaneously, while we are collecting oxygen in the blood, we are also unloading carbon dioxide. All right, and then that oxygenated blood will then recirculate back, in through the pulmonary veins from each lung, drain into the left atrium, left ventricle, and then out the aorta to the rest of the body. All right, so you probably getting the picture here. We need these septums to keep these four chambers separate. We don't want mixing of blood going on. All right, that's very bad. Now, it could be, how bad it is depends on what direction the mixing is taking place. All right, and I'm assuming you've heard of some of you may not have heard, we call this the tetralogy of Fallot. It's a medical condition that most people commonly think of as a hole in the heart. All right, so and when people have a hole in the heart, it's typically in this interventricular septum. All right, and what happens then is blood will either move from right to left or from left to right through this hole in the heart, and we'll have mixing of deoxygenated and well oxygenated blood. Now let me ask you guys this. I want to give you guys, a good like 15 seconds or so to think about this. These are called shunts, by the way. Which one would be worse? Which one do you think would clinically be more dangerous? A left to right shunt, so this top one, we'll call this letter A, or a right to left shunt. We'll call that letter B. We'll just give you a few seconds to think about that. Okay. If you said a left to right shunt is going to be more dangerous, you are wrong. It is going to be right to left, and here's why. Because if we are mixing blood between the two chambers, all right, you have to remember, if some of this deoxygenated blood leaks over to the right side of the heart, it's just going to go up to the lungs, undergo gas exchange, and get reoxygenated. If we have more of it leaking from the right to the left, it's going to be going out the left ventricle, out the aorta to the rest of the body. So we'll be circulated, so we'll be sending out less and less oxygenated blood to our tissues, and that's not a scenario you really want to have to deal with. So those right to lefts are a lot more dangerous, and oftentimes they can, just those holes can go in their own. Sometimes they require surgical intervention. It just depends on the case. So if you hear about a baby or a person being born with a hole in their heart, that's typically what they're referring to. All right, so let's keep that in mind. So we've got that out of the way. Talked about the moderator band. So talked about the left ventricle, and again, talked about the thickness, the wall thickness, and then this right here would be the IV, what's often abbreviated the IV septum, and then this is, I should have had somebody stick their thumb in there opening up. I apologize for that, but would be where the right ventricle is, and again, it's easy to tell, myocardium, myocardium, and then right here, these would be those papillary muscles. And then you can see these cords that are extending off of here. Those would be the chordae tendineae. And then there are these leaf-like valves that are located right there. All right, that are basically between the chambers of the heart. And then here again, this is a much better view. So again, this would be the IV septum. This would be the right ventricle. Gosh darn it. This would be the right ventricle of the heart. This would be the left ventricle of the heart, or the myocardium, I should say. And then here again would be, papillary muscle. And then you can see these cords that are extending off. And then here's the other side of the septum here. Okay. And then here, this is kind of neat. This is a cusp to the aortic valve. And then you can see again these, how thick the myocardium is. Blah, blah, blah. So this is actually a cusp or a leaflet to the aortic valve, which is one of the semilunar valves. I haven't talked about them yet. Exact same picture I just showed you. Here's a closer look at the chordae tendineae, or the tendinous cords. I think I like that picture there. That's kind of neat. So Yeah, so just that's a little bit of an overview of the inside of the heart. I think what I'll do now is, I'm at about 50 minutes now. I'm going to stop here. I'm going to make another shorter video on the valves of the heart, talk a little bit about valvular mechanics, and then that'll be kind of my overview of the gross anatomy of the heart. If you have any questions, I mean, don't hesitate to contact me. Um, so I haven't gone over semi-lunar valve. Whoops. So I haven't gone over semi-lunar valves yet in this video, and I also haven't gone over AV valves yet. But all these other structures, I think I've pretty much covered. I have another video covering coronary arteries and veins, the actual veins and arteries of the heart itself. So again, if you have any questions, don't hesitate to contact me. And well, good luck and study hard.